Well, I really thank you for sharing your views. We have, I think, very few minutes. If there are any reflections or questions to the panel, I would allow one or two questions. Yes, please. Please introduce yourselves. I don't know if you have a mic.
Dr. Sanjay Kumar, Executive Director of National Health System Resource Center. And this whole panel discussion gave me a lot of points for reflection. And 3 points for us to follow. One is how do we define health system? And the typical definition which we use is WHO definition. 4 outcomes are fine, but the 6 components stop at the health system itself, doesn't include community. And I was looking at about 15 years back when this framework came out, and I was based in Geneva. I did my homework and looked at World Bank Health Outcome Framework. I found that was closer to reality because it included the social determinant, it included the community behavior in it. So one is we need to be clear, how do we define health system? Because our objective is to improve health outcome, not improve health system alone. Health system to improve health outcome. So that is one question or one thing I have been reflecting on. Second is we have huge infrastructure of health institutions in the country. We have 381 medical colleges at the last count, and we have many health institutions. Some of them are included among the panelists who have come from those institutions. Are we asking the right question? When you do your MD or PhD, that is the stage when you have to inculcate this practice of asking the right question. All of us do our PhDs, MDs, and it goes on the shelf. We don't get into asking the right question. So it needs to get to that stage when you groom the youngsters getting into the system, get them to ask the right question. And then bringing them all together, maybe a consortium and NHSRC being part of that group, work with SHSRCs, work with training institutions, bring all of them together. We have a huge resource out there. There is no dearth of people who can work in this area, but we need to include everybody. It has to be all inclusive. Thank you.
Thank you. Yes, please. I'm asking the organizer. I have reached my time limit. We have another 5 minutes.
I want to ask a question to John. When you talked about the universal health coverage, I personally have, in the context of India, I have some concerns using that terminology itself. Universal, initially, when I started working on the project, I thought it's like universal, like everybody in India, like people like you and me are going to get covered. So I think we need to be very careful with the kind of terminologies that we're using, because it's really not universal in India like probably how Brazil and Cuba would do. So my question is, why are we really picking up some terminologies like that and just using it when we don't even have the intent to provide health services to each and everybody in the country? That's a huge concern. So those terminology specific, I think we need to be very careful. Secondly, speaking of social justice, rights and dignity, I think there are some missing gaps, that are addressed in the research, which would, if addressed, would really be fruitful in providing interventions and probably leading to the success of health systems functioning very well. So I think academic research, like how Sir pointed out about involving everybody, I think academic research like PhDs and MPhils should also be used in this regard, because there are really some studies which, like having done PhD, I know of some students who have done it. Talking about health resources in the health system, there are certain, not everybody, but certain doctors, nurses who would, behave so violently with the patients that it's not actually the lack of resources that people, because of the lack of resources that people don't go to the health facilities, but it is also because of the treatment which is being provided to them, even to the extent of being beaten up, and that's why they don't go there. So things like these don't even come up in the, I haven't seen that, they don't come up. I think we need to address that as well.
Thanks very much.
Universal health coverage, I believe that the next panel is focusing particularly on universal health coverage. And just your point about the stories on the front line, that's exactly what health systems and policy research is about. It's about bringing those stories through the system, through the policy at the local level, the district, right up. So it's really listening to the bottom and connecting it to the top. So that's a very important part of what we're talking about.
One more question and I have to close the portion. No, unfortunately, somebody got mic before you. But I can give you, if you promise me 1 minute, then I can give my
Hello. I have a small comment. I think when you say health HPSR, we have been talking about the building block model of WHO, especially in India. But somehow the context of health system, that is the dynamism of the health system, that is missing somewhere in the research as well. For example, the deficit, the acronym says demographic, epidemiological, political, cultural, social, technological, and economic. These points are somehow missing while we are only focusing on the 6 building blocks of the health system. So that need to be revived. And second comment I want to make is, what are the incentives or disincentives for the government people or the public sector people? Why they should be in the HPSR? That we need to think about. Thank you.
Thank you. I hope it's noted. And I have one more question for 1 minute for you. Yes. Yes, sir, you.
Yes, I'm Dr. Hira from PHFI. The question is, I really saw a very complex picture of research being presented, obviously, as part of the entire organizational system. But I want to make one comment, and that is health research should be considered as part of the health system, and we do need to demystify the entire process. It looked very, very complex to me. Thanks.
Thanks very much. Before I close the session, and because I won't be sitting in this panel in the next session, and I know that my friend Srinath Reddy will do all the justice to the universal health coverage, is something he really fights for. But I am fighting along the same line. So let me say just one thing to the lady behind there who has made these comments. Universal health coverage is not about any specific number and target. Universal health coverage is a direction, it's a vision. No country has achieved universal health coverage so that every service is provided for everybody. No country can afford that. That's understandable. It's a kind of stepwise implementation of the vision where you want to improve and achieve coverage. And the word universality here is about equity and about human rights. So you have to find a way that all the people in the country are equal in terms of their right to have access to necessary health services, and they are covered by them. So, but it can't happen immediately, and we should not drop the vision because we can't achieve it today, because then you don't see where you're going. So it's extremely important to keep the vision, but make a good plan of how you're going to get there. Thank you very much to all my panelists today. I think it was a very rich discussion. I hope everybody agrees, and I'm sure those points will be taken on board by PHFI group, who will take it in the next level of discussion. Thank you very much.